Hi everyone, Dr. Bill McCallum here. Welcome to our first topic of the week. We hope to share some valuable health information with you on a weekly basis through these short video casts that we're having. Today's topic, simple explanation of how chiropractic helps improve a patient's health. And I want to walk you through this today. I go through this normally with a new patient. I want you to think about what's out there. On this chart, these are your heart, liver, kidneys. These are all your organs. Now, are they smart on their own? No, they need a little help, don't they? So what's this guy up here? The brain, exactly. And what is the brain's job? What's its role in the body? To control the function of everything else going on inside your body, isn't it? And how does it do that? It sends messages or information down along the spinal cord, which is housed by these 24 movable segments that make up your spine. And there are little openings in the segments where the nerves go out to innervate all the different organs and cells and tissues of your body. So as long as the information is getting through from the brain out to those organs properly, what's going to happen? If there's no interference, they're going to function properly. Now, what happens is, when you get these subluxations, you can get misalignments in your spine that can cause interference to the messages getting from the brain out to the body through the spinal cord or through the little openings between the bones there. When that occurs, what happens is these organs are not going to work properly. They're not going to get the information they need, so they're not going to function properly. And initially it's just physiological. They may not be physiologically working well, but if you leave the pressure on the nerve long enough, it can lead to a state of what we call dis-ease. And that's often when you have symptoms, you go to your doctor, and he's going to try to give you some medications to try to cover up the symptoms, but it may not be getting to the actual cause of the problem. And if you leave the pressure on the nerve long enough, it can actually lead to an even more severe state. Everybody knows Christopher Reeve. Here he fractured dislocation of his neck, severe damage to his nervous system. He had no function below the level of his injury. None of the organs were working, and he died 9 years later, not because of old age or genetics, but because those organs eventually just shut down. No more power from the brain, no more function. So when we're adjusting a patient, then what a chiropractor does is adjust your spine, trying to realign it, get the pressure off the spinal cord of the nerve, and now we're allowing the brain to communicate better with these organs out here. So when that occurs, what's happening? Are these organs going to be starting to function better? So are they moving towards sickness or towards health now? They're moving towards health, aren't they? Now, does that happen every time? It does. Every time we adjust a spine, if that brain's communicating better, you're moving towards health. So who needs chiropractic care? Probably everybody does. They just don't understand this neurological side of what we do. And when should it start? Well, probably as early as possible, but that's a topic for another video. We'll talk about children and the birth process and how that can affect the spine. So I hope you've enjoyed this quick topic today, and watch for us next week. We encourage you to, if you found this information useful, please share it with your family and friends, and click the like button above too, please, so that we get some support. Thanks very much. We'll see you next week.